Across the country, states and municipalities are enacting higher minimum wages, and in some cases, living wages, while others are looking at mandatory paid sick leave for some workers. Our challenge and our task is to explore this issue, listen to the range of people, both the experts and the people who are trying to survive here day to day on their income, sometimes at the minimum. We will work through our fact-finding and our public hearings to craft recommendations that can improve not only the lives of the families, but when we do that, we strengthen our state's economy. Today we gathered here for the first step, taking testimony from those willing to provide publicly testimony on the issue.
So when measuring economic adequacy, the most commonly referenced metric is the federal poverty line. This threshold is supposed to represent the income level needed to be just free of outright material deprivation. The federal poverty line was conceived in the 1950s and only updated for inflation since then. So as a consequence of this, researchers universally agree that the poverty line is a woefully inadequate measure of what it actually takes for a typical family to survive today. As such, a number of alternative measures have been made, but perhaps the most useful in assessing true economic security is a measure developed by my colleagues at the Economic Policy Institute called the Family Budget Calculator. This calculator estimates the level of family income required to attain a secure but modest standard of living. It incorporates community-specific cost information on housing, food, childcare, transportation, healthcare, taxes, and other necessities, and provides thresholds for 6 different family types localized to 615 communities throughout the country. According to our data, in Delaware, a 2-adult, 2-child family would need $71,171 in annual income to be above the family budget threshold. This equates to an hourly wage of $17.11 per hour for each parent. In 2013, an hourly wage of $17.11 would be equal to roughly the 48th percentile wage in the state of Delaware. This means that 48%, nearly half of Delaware's workers, earn too little to meet this threshold. There are roughly 74,000 low-wage workers under this threshold in Delaware. Of these workers, almost 60% are women, more than a quarter of them are parents, and more than half of them work full-time. The largest shares are in service and sales occupations, and the majority of these workers are in the retail and leisure and hospitality industries. Despite common misperceptions, the vast majority of low-wage workers are not teenagers. In Delaware, 85% are at least 20 years old, and 57% are at least 25 years old. Most have completed high school, about 80%, and over 40% have some college experience. While the majority of these low-wage workers are white, Black and Hispanic workers are disproportionately represented. African Americans comprise roughly 20% of all Delaware workers, yet account for 26% of low-wage workers. Similarly, Hispanics and Latinos make up about 8% of Delaware workers, yet account for 16% of this low-wage workforce. These workers are overwhelmingly coming from low to moderate total income families. Nearly half have total family incomes below $40,000 a year, and almost 2/3 have total family incomes below $60,000 a year. Finally, I mentioned that more than a quarter of these low-wage workers are parents. In fact, they are parents to 33,000 Delaware children, roughly 16% of all children in the state. From 1979 through 2013, average output per worker expanded 64% for workers in Delaware. Yet median hourly compensation grew only 15.6%. For low-wage workers, it was even worse. From 1979 to 2013, workers in the bottom fifth of the wage distribution in Delaware actually saw their wages fall by 5.5% after adjusting for inflation. In other words, despite the fact that low-wage workers in Delaware are older, better educated, and producing more income for their employers than their counterparts 40 years ago, today's workers are in fact being paid less.
You just don't want to be taken advantage of anymore. You don't deserve to be treated like we're not equal. You just want to change. Right?
Thank you very much for the opportunity to speak here today. My name, as you said, is Rachel West. I'm a senior policy analyst at Center for American Progress in Washington, D.C. Prior to joining American Progress, I was a researcher at the University of California, Berkeley. My research at Berkeley focused on how minimum wage policy affects government spending on public assistance programs. It's this research, along with the discussion of how minimum wage policy affects the overall state economy, that I'd like to focus on today. And every time that I say the words minimum wage, I would like to ask if you would to think about moving a minimum wage toward a livable wage. And so when we begin to think of the two, when they are at a level where they are indistinguishable, that's the goal. So let me first state that the chief objective of minimum wage policy is to ensure a decent standard of living for low-wage workers and to promote upward economic mobility among these workers and their families. An extensive body of research shows that past minimum wage increases have successfully achieved these goals. A host of studies show that higher minimum wages lead to increased earnings and reduced poverty among low-wage workers. And, very importantly, that minimum wage increases do not lead to job loss. So in a forthcoming study co-authored with Dr. Michael Reich, who's a professor of economics at Berkeley, I examine how minimum wage increases have affected spending on what is one of the largest taxpayer-financed public programs, Medicaid. Our results robustly show that higher minimum wages cause Medicaid enrollment to decline. This study follows on the heels of our other previous research, which showed that past minimum wage increases have reduced spending on the Supplemental Nutrition Assistance Program, which is formerly known as food stamps. In a time of both tight government budgets and increasing alarm over income inequality, the possibility that higher minimum wages reduce public spending holds great relevance for both taxpayers and policymakers. So let me explain how higher minimum wages would reduce Delaware's Medicaid spending. Prior to the Affordable Care Act, or the ACA, 88% of Delaware's Medicaid recipients were low-income individuals who neither elderly nor disabled. Delaware paid 46% of their Medicaid costs. The federal government pays the rest. For these recipients, eligibility depended on income. Prior to the ACA, an individual who exceeded a designated income threshold, which was between 100 and 120% of the federal poverty level, would lose Medicaid coverage altogether. But today, thanks to Delaware's Medicaid expansion, all individuals up to 138% of the federal poverty level remain eligible. But there's an important difference in how their coverage is paid for. Delaware does not share in the cost of the coverage of newly eligible individuals under the ACA. Instead, the federal government pays the full cost of their care. So, if a minimum wage increase lifts the income of certain Medicaid participants, pushing them over that former income threshold, Delaware taxpayers experience savings. But at the same time, struggling families both see their earnings rise and they retain their health care coverage. This represents a win-win situation for Delaware taxpayers and low-income families. So following the methods in our forthcoming report, a conservative estimate indicates that raising the minimum wage in Delaware to $12 an hour in 2015 would save Delaware taxpayers $16.6 million per year, or 2.3% of the 2012 Medicaid spending costs. And that's in each year following.
We've gone backwards. The starting salary in auto plant now is $14 an hour. Let me back up. $14 an hour. I think I was making that back in the 80s, and when I was working in the auto plant. There's been a real surge in this country to try to lower the wages of workers. I think we've all seen where workers' wages have lowered, and those on the top are wrong, have gone up, and we're suffering. We're all being Walmartized. And if we do raise their salaries, then we cut back on their hours. So now we're not doing 40 hours. So therefore, if you don't do 40 hours, then you can't get benefits, and you can't get this, and you can't get that. And so, that's the trend now. And so, I don't even like minimum wage. We all ought to be making a livable wage. Right. You got to start somewhere. And the great thing is that all changes happen at the local level. That's why all politics is local. The biggest changes are made in the municipalities all across this country, whether it's in Washington or Colorado or wherever. They're the ones making the changes in the wages as it relates to workers. We have an example of that right here with our county and what the county exec and the board did as it relates to workers. And so, we're going to make those changes. This is a great place to start in the states. If we ever get a national minimum wage, it's going to be because states force it and states make them give us a minimum wage.
My name is Jack Tumble. I'm a policy analyst at the National Employment Law Project. We're a nonprofit, nonpartisan research organization based in New York. We've worked around the country with local, state, and federal lawmakers on a range of different workforce and employment-related issues. A NELP analysis of BLS data finds that 80% of jobs that were lost in Delaware over the course of the recession were in mid-wage and high-wage industries. Yet the majority, 54%, of jobs created in Delaware during the post-recession recovery have been in lower-wage industries. This pattern of bottom-heavy job growth in Delaware over the course of the recovery has left the state with an enduring deficit of good jobs that pay a decent wage. Today, there are still 15,994 fewer jobs in mid and high wage industries than there were before the recession took hold. By contrast, there are now 4,293 more jobs in lower wage industries than existed before the recession. So while the economy in Delaware and in states across the country has been reorienting towards low wage industries in recent years, what the data show are that the Great Recession and the subsequent unbalanced recovery in the state have now accelerated this trend. I want to note particularly the role that several key industries have played, both in the unbalanced job loss during the recession and in the post-recession recovery. It's important to note that steep losses both in the manufacturing and the construction industries accounted for a large share, 44% alone, of all job losses in the state during the recession. By contrast, job growth in Delaware remains strongest today in low-paying service-providing industries, the subject of today's hearing, specifically in restaurants, retail, and in administrative and support services, which includes janitorial, security, and other. The decision by many profitable companies, and particularly in the fast food industry, to, in this case, move overseas for tax reasons, is actually consistent with a really harmful business model that we've seen, where these very same companies pay low wages, offer limited benefits and limited hours, and essentially force taxpayers to then subsidize their payroll costs. In other words, they're already benefiting from a substantial subsidy from being in the U.S. by essentially taking advantage of the safety net. We know that as a country, we're not going to let low-paid workers, completely starve, and so we would want to have SNAP benefits, or we would want, we want to have other kinds of public assistance because we believe that when companies pay too little, it's important to assure a basic standard. But without wage standards to ensure that profitable companies are meeting their end of the bargain, then we open up a system where companies can actually take advantage of taxpayer funding and the public safety net to essentially supplement their payrolls. I think you're right to touch on this and see it as part of essentially a business model.
Yeah, cool. And I'll stop at this. Like in 1942, the taxes was 40% for corporate America. Now it's almost 3 to 5%. And I think this is where a lot of our problems are, but that's a different subject. Thank you.
Down there, Bob.
Thank you. Brian?
One of my members told me about this meeting about supporting food workers and living wage standards. So I said, let me come on down and see what it's about. After sitting here and listening and Pastor Bullock and Reverend Layton down here, and hearing that gentleman just speak, it made me think of a quote that's just so appropriate that Martin Luther King mentioned in Memphis. He said, there's dignity in all labor, but we're here doing another thing. We are reminding not just Memphis, but we're reminding the nation that it is a crime for people who live in this rich nation and receive starvation wages.
Right.
He went on and said, we built gigantic buildings that kiss the skies. We built gigantic bridges that span the seas. Through our spaceships, we're able to carve highways through the stratosphere. Through our airplanes, we're able to dwarf distance and place time in chains. Through our submarines, we're able to penetrate oceanic depths. But it seems I hear the God of the universe say, even though we've done all that, I was hungry and you fed me not. I just think that's so appropriate what we're talking about. So one of the things I want to take care from here tonight is I want to speak to whoever the organizer is of this event and find a way that Labor's Local 55 could work together, because these are all industry problems. There's exploitation, there's the race to the bottom. And unless we stick together, there'll be no peace. So that's all I want to say, and thank you for the time.
Public information, we will meet again in a public hearing in October. The location will be determined. I think what we learned today is that this task force can focus on wage issues in Delaware, labor law enforcement, and I think the gentleman that was here earlier, who shared and defined the, not too long ago, but long ago enough, when he referenced President Kennedy, Senator Kennedy, Dr. King, and then John Blyden, who did the same. And I think and we've talked about patriotism of U.S. corporations to America and the American worker. And I think that if we could spark a state debate that could spark a national debate about how the U.S. corporations, who are now global and don't have a whole lot of commitment to America and our workers, if we could force some kind of national debate starting in little old Delaware, that could have a significant impact looking ahead. But look, business want to make money. You know, people work, they invest their time, they make effort, they take risks. But the big corporations, you know what? We need to let them know that you better behave and get the act together with the American worker, or we, the 99 and 9/10, may come over the